You can turn subtitles on by clicking this symbol in the bottom right corner. By clicking the cog next to this, you can also adjust the playback speed to make the speech whatever speed you feel comfortable listening to.
In this video, we will show you what to expect from an abdominal aortic aneurysm screening. When you arrive for your screening appointment, you should check in at the main reception desk of the screening venue you are attending. The receptionist will confirm your name and then direct you to the correct waiting area. One of the screening team will come out at the time of your appointment to call your name and walk you to the clinic room where your screening will take place. At most screening appointments, there will be 2 screeners present, but occasionally there will only be one.
Richard Jones, if you'd like to follow me, please, sir. Right, good morning, Richard.
Good morning.
If you'd like to hang your coat up on the hook provided, and but anything you don't want to take onto the couch, if you'd like to put on the chair. Right, if you'd like to come and take a seat on the couch.
Okay.
I need to ask, did you receive our leaflet through the post?
This is your time to answer.
Yes.
Okay, I'm just going to very quickly explain what we're going to do. Okay. We're going to use the ultrasound machine here to do a scan of your abdominal aorta. Okay. The aorta is a main blood vessel in the body. It runs from the heart, up over the chest, down through the middle of the abdomen and divides into your legs. Okay. We're going to be looking at the part that runs through your abdomen. Right. What we're looking for today is an aneurysm. An aneurysm is a weakening and a swelling within the walls of the aorta, and it starts to expand. Because there are no symptoms of this condition, that's why we do a scan for you today. Okay, do you have any questions?
This is your time to answer.
No.
Okay, I just need to ask you a few questions. Do you have any do you know if you have any family history of aneurysms?
No.
Have you ever had any surgery on your aorta?
No.
And is it okay if we store and use the data that we're collecting today for research purposes?
Yes.
Okay, thank you very much. If you'd like to lay down on your back and just lift your t-shirt up to the top of your chest.
Okay.
Right, Richard, if you'd like to lay your head back for me and make yourself as comfortable as possible, I'm just going to put on a surgical glove. And I'm going to put a bit of tissue on your trousers so we don't get too much gel everywhere. Okay. Right, could you just confirm your name?
Richard Jones.
And your date of birth?
24th of May, 1960.
Okay, thank you. Right, I'm just now going to put a little bit of gel on your tummy. It may be a little chilly.
The gel may feel sticky when you're being screened.
Now, if you can keep your tummy as soft and relaxed as possible whilst I'll do the scan, it just helps me get better images and I won't have to press down too hard on your tummy.
Okay.
Okay? Right, I'm just moving the gel around so it covers your tummy. And if you can keep it as soft and relaxed as possible.
The screener may have to press harder. This can be uncomfortable, but if you're in too much discomfort, you can ask the screener to stop.
Now, the first thing I'm going to be looking for is what we call the bifurcation, and it's where your aorta splits down into your legs. Okay, I'll take an image of that for you. Now I'm going to look at the full length of your aorta. and everything looks absolutely fine. I will take an image of that and measure it for you. And the last image I'm going to take is a cross-section view of your aorta, which I will take an image and measure that for you as well. Everything looks absolutely fine. There don't seem to be any problems with an aneurysm there. If you'd like to take the tissue and just give yourself a wipe down to clean up the gel.
The screener will ask you if you need any more tissue to wipe away any remaining gel. You can leave the tissue on the bed and the screeners will dispose of the tissue along with the couch roll.
So, when we do a scan for you, what we do is we take images and we measure those images to check they're below 3 centimetres.
Okay.
Yours is measuring around about 1.7 centimetres. So you're well below the 3 centimetre threshold for an aneurysm. Because you don't have an aneurysm and they take so long to develop, it will just be a one-off scan for you today.
Okay.
We won't need to see you again. We'll discharge you from the programme and we'll just pass this information on to your GP, who will put them on your NHS records for you.
Okay, fine.
Okay, have you got any questions?
This is your time to answer.
No.
We're all finished. The only thing I need to add to this is that all our images are quality checked, and there may be a small chance that you get called back for a quality assurance rescan.
Okay.
But it is very unlikely that that will happen. Okay, so if you do hear from it, it's not because they've found anything, it's just because they want to check out the quality of our images.
Okay.
Okay, thank you very much. If you'd like to sit yourself up. Well, thank you very much, Richard, for coming today. If you'd like to collect your things off the chair and put your coat on, the scan is now complete, and we won't need to see you again.
Lovely. Thank you very much.
Thank you very much.
Thank you.
Thank you very much, Richard, and have a nice rest of your day.
Lovely. Thank you.
Thank you. Bye-bye.
Bye-bye.
What happens if an aneurysm is found?
When we do a scan, we take images and we measure those images to check that it's less than 3 centimetres. Your aorta is less than 3 centimetres. If your aorta is 3 centimetres or over, you have an aneurysm. A small aneurysm is between 3 centimetres and 4.4 centimetres. If a small aneurysm is found, then we would like to monitor you once a year as the aneurysm grows. So we will invite you back for another screening every year. When your aneurysm reaches 4.5 centimetres to 5.4 centimetres, it's then classed as a medium aneurysm, which we monitor every 3 months. If your aneurysm grows to 5.5 centimetres, we will then refer you to our vascular surgical team, who will then call you in to discuss further treatment for your aneurysm.
We hope you found this video helpful. If you have more questions, you can call the telephone number on your invitation letter. You can also talk to your GP for more information or visit the NHS website.